Hello and welcome. So today we're going to be talking about urinary incontinence types. So this is the normal bladder, this is the normal urethra, normal sizes. And so as you can see, there are three types of urinary incontinence: urge, stress, and overflow. So what's the difference between those? So in urge incontinence, you have the detrusor muscle hyperactivity. So the bladder gets tight and smaller, and then so urinary incontinence happens. In stress over incontinence, however, there's a problem in the urethra. It is wide, it's more wide. And this is happens like, for example, after a couple of pregnancy complications. So this is wide and leaks urine. And the last type of urinary incontinence is the overflow incontinence. And this can happen to two reasons. Either you have an atonic bladder, so it does not contract, and so urine accumulates and eventually start dripping. And the other cause of it is a narrow urethra, which happens like, for example, after a benign prostatic hypertrophy. So from the causes of these three, you can kind of guess what the treatment is. Um, so in this case, in the urgent incontinence, the solution is to paralyze the bladder, and for example, by using antimuscarinics, for example. In stress urinary incontinence, the treatment is like either Kegel exercises. We want to narrow this channel, so we can use like either Kegel exercises, something like training. And for the last part, you can either stimulate the you can either stimulate um, contraction of the bladder, like for example by using muscarinic agonists. And for the second reason, we can do like a benign prostatic hypertrophy surgery, or for example, using alpha 1 blockers like tamsulosin and such. Thank you so much.